Hello, everybody. Welcome to the Natural Food Pantry Education Series. I'm here today with my guest, naturopathic doctor NavNirat Nibber, who is here to talk to us today about sleep. Dr. Nibber is a graduate of the Canadian College of Naturopathic Medicine, a registered naturopathic doctor, and the recipient of the 2015 Naturopathic Honor Award. In addition to her clinical and consulting work, Dr. Nibber is a medical advisor and brand educator for AOR, Advanced Orthomolecular Research, engaging with international research in the naturopathic field, and is a published health expert in over 25 international publications. Warm welcome, Dr. Nibber. I'm so happy to have you with us today for this conversation on such an important topic.
Yes, thank you so much for having me. I'm looking forward to our chat today.
Yes, so sleep is such an important aspect of our health, so much so that I know many naturopathic doctors, many colleagues of mine will actually prescribe sleep to their patients as a remedy or a solution to a variety of health issues. Through Natural Food Pantry, I teach a webinar on the connection between stress, sleep, and our eating habits. And in the webinar, I explain that there's this feedback loop between the three, so that when one is out of balance, the others will also become imbalanced in some way or another. And all three are really pillars they're foundational to our health and well-being. Now, because of this feedback loop, if we put some effort and emphasis on supporting and improving one of those areas of our health, so whether it's sleep or stress management or our eating habits, then the others become more manageable naturally. Would you agree?
Yes, absolutely. And I think that's so important to break it down into those fundamental pillars. And the reason that that sleep is so important and so integral, but it seems almost basic to give it as a treatment, but it is, in fact, as you say, a therapeutic option. So the reason it is so integral is because, as you've already mentioned, everything is connected, where our bodies don't operate in these singular silos. Everything is communicating and connected. So those pillars, that axis that it forms, sleep, stress, our digestive function, our nutrition, our bodies are very good at extracting nutrients and then communicating with the different parts. Where sleep comes into play is that consolidation of information and that kind of prepping and priming. So while you are physically asleep, so many processes are being restored and regenerated and optimized while you sleep. So of course, we start to see a lot of dysfunctions that happen when one of those is out of that equilibrium or out of that homeostasis. So everything then is either trying to compensate or overcompensate sometimes for something maybe not functioning optimally. So yes, if we think about the pillars of our health, we want it to be in those most simplified forms: eat well, rest, have your excretion pathways working, um, and mitigate stress. So nothing is, again, we want to look at the holistic. Nothing is just working in one way. It's not as rigid. Our bodies are very flexible and they're very holistic. So treatment approaches need to be both of those things, flexible and holistic.
Absolutely. And so on that note, on the note of holistic, I think a lot of people, obviously, people recognize fatigue and exhaustion and maybe brain fog as results of poor sleep or insomnia. What are some of the other sort of more complex issues health issues that people might experience that they don't necessarily link to poor sleep, but in fact are related to poor sleep?
Yeah, and that's a great question because, again, we always maybe make those assumptions of, well, I'm tired, I just feel fatigued. But really, when we have consistent sleep dysfunction, it can start impacting your immune function. You're no longer able to mount those appropriate responses. You can have, well, cognitive decline is very well characterized. I know we talked about fatigue a little, but cognitive decline can actually occur even with a 45-minute delay in sleep onset or induction. So we start to see that very quickly, and it's well characterized in things like Alzheimer's disease. Is there's a sleep dysfunction, it impacts our mood and our stress because it's also then impacting hormone levels. It's very important in the, and we'll break down like the stages of sleep, but in deep sleep, we're doing so much of that restorative activity, and part of that is related to the hormones. So there's a huge cascade effect. So immunity is dysfunctional. You can start to lose some of that skeletal muscle mass. So again, you're going to the gym and working out, but if you're not sleeping properly, you're not able to maintain that muscle mass, which I think a lot of people don't necessarily equate. It can impact your stomach acid production and those cues, because melatonin is linked with those hunger and satiety cues. So it can change your appetite. So yeah, dysfunctional sleep then cascades into every facet of your life, essentially, seemingly, right?
Yeah, really. Like I don't think there's an area of our health that's untouched when we're not sleeping properly. And I think
Mm-hmm.
a lot of people who are parents probably are familiar with that, right? I'm thinking back, I have 3 kids, and when they were babies and we were up hours and hours and hours at night with them, I would go into work the next day and just feel so disoriented. And I remember one time actually walking into a wall thinking, what's going on with my brain? And it was simply sleep deprivation.
And that's such an interesting point that you bring up is, um, in different phases of our lives, we may go through periods of sleep dysregulation. And I think what we're seeing is more and more those periods are becoming longer. And also it's important to note that there is a natural movement throughout our lives. We go from kind of a polyphasic, that's why babies wake up multiple times, to a singular or a biphasic sleep pattern. And so when people make those recommendations of, you must get, 6 to 9 hours of sleep, it's actually more important to understand the period of life and your period of growth and development, and make those recommendations for sleep based off of that. Because as you said, a baby or an adolescent, or even an elderly person have very different sleep needs and requirements,
Yeah.
because again, sleep is consolidating, hormone function, or if there's a growth spurt happening, there needs to be longer deep sleep or stage 3. So again, sleep, the stage of your life is just as important as that can dictate those recommendations.
Yeah. Yeah, for sure. And so you mentioned consolidation while we sleep. Can you explain a little bit more what happens in the body while we're sleeping? Why is sleep so important?
Yeah, so there's I think we've classically heard, about REM sleep, that rapid eye movement sleep where we're dreaming, but there's actually 3 phases of sleep preceding that. So we break it down into REM cycle and then non-REM cycle sleep. So in the non-REM cycle sleep, stages 1 and 2 are kind of where you fall into sleep. It's where your body is starting to relax and wind down, if you will. And then stage 3, this is deep sleep. It precedes non-REM or REM sleep, sorry. And in that phase, that's what I mean by the memory consolidation. That's where we're getting basically all our everything is winding down. It's really hard to wake you up or be modified by external stimuli in that point. But that really deep sleep is the very restorative side. That's where we're getting, the upregulation of our immune system. That's where we're starting to support normal hormone synthesis. And for this to occur, we also really need the stress levels of cortisol to be quite low. So, um, kind of getting back to your point of why is sleep so important, is because if we're missing this deep sleep phase, that stage preceding the REM cycle, you're not able to, your body isn't able to basically do that. That time to do it gets shortened. And we see those who study sleep, in depth, they have recognized and pointed this deep sleep phase out as kind of one of the most important. And there are ways that you can start to optimize sleep, especially that deep sleep, and just make sure that you get enough cycles, because like I said, the non-REM sleep and the REM sleep occur together, but they occur in a cycle. So you want 4 to 5 every night. And what we're seeing is people are getting fewer of those cycles because we're either going to bed later, or we're on our phones, or there's a lot of ambient light in our rooms.
Right, right. So let's talk about what people can do. Insomnia and sleep, poor sleep quality can stem from other complex issues as well. And I've noticed that most people improve quite dramatically just by incorporating healthier sleep habits, or what we call sleep hygiene. So what are some of your top recommendations for people who are struggling with sleep? Either they're, having a hard time falling asleep at the start of the night, or they're waking up throughout the night, having a hard time getting back to sleep, waking up feeling exhausted. What can they do?
Yeah, you've kind of outlined the treatment approach, which is, are people having trouble falling asleep? So that's called sleep induction. So we can do either therapies where we're delaying or altering the sleep cycle. You can also do things whereby you're actually supporting the 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 calming or the activation of your parasympathetic nervous system, so that that rest and digest pathway, which allows you to sleep. So that is usually in and around stress management, making sure that the environment that you're sleeping in is conducive to sleep. So what that means is you really need it to be dark. So when we're talking about sleep hygiene, I want it to be as little ambient light, so that can be from battery packs. Cover up your battery packs, get those blackout blinds, and then have some sort of ritual for that sleep induction. So have a process where you're winding down. It can either be a bath or something that brings down that system. And then to ensure that you're staying able to stay asleep. Sometimes temperature regulation is important. So ensuring that the body is cool at a cool enough temperature. And then other sleep hygiene is, I always say, the bookends of your day. So the last 30 minutes before bed, and then when you first wake up, making sure you're activating your cortisol in the right way. So try to look at as much natural bright light as you can first thing in the morning. And then throughout the day, try to mitigate and manage your stress levels so that you don't get this huge spike later at night, because that disrupts your melatonin production. But I'm sorry, I feel like I went on. There's so much.
That's okay. That's okay. And I'm going to ask about food, because being a nutritionist and, working for the Natural Food Pantry, we have to bring that into the conversation. So what about, some people advise having certain snacks before bed to help, and other people advise not eating after 6 or 7 o'clock at night. What are your feelings on that?
Yeah, so I would say that there needs to be an individualized approach, because for individuals who, let's say, have a lot of acid reflux, eating very close to bed can actually be very detrimental. Generally, you want to give your body sufficient time. So, whether that's, between 2 hours to up half an hour before clearing out that space. So some of that research is in and around keeping your metabolism active. Generally, you don't want to eat right before bed. And then the types of foods you're eating throughout the day, I think, is important where it comes into those other factors related to sleep dysregulation. So is there a lot of inflammation in the body? Because that will also then impact sleep, and it's that cycle. So anti-inflammatory foods, avoiding foods that you're already sensitive to. And then in terms of that ritual, having, you can incorporate calming herbal teas, you can incorporate a lot of those botanicals, and sometimes supplementation can be helpful if people are suffering from more of those long-standing sleep dysregulation.
Yeah, and on the note of supplementation, there's a whole array of wonderful sleep products on the market, natural sleep products. Ortho Sleep by AOR is definitely a top seller. It's a product that's used by a lot of naturopathic doctors and health practitioners. We have really good results and feedback on the product here at the store. Can you tell us a little bit about Ortho Sleep and how it works?
Yeah, absolutely. So, generally, when we're thinking of complex, that sleep complex, we want something that will support the three phases. So, the falling asleep, the staying asleep, and then your circadian rhythm. So, when we were designing this product, there are the ingredients that help induce, those slower brain waves, the relaxing brain waves, the L-theanine, GABA, and then we use botanicals as well, like the passion flower and the lemon balm, just to help bring your body into that parasympathetic state, that relaxed state. And then once you're actually asleep, it's really important to have regular melatonin production. And when we have a lot of ambient light, or if we're changing time zones very regularly, that melatonin production can be thrown off. So supplementation with melatonin is important in those cases. And it's interesting with Ortho Sleep because it's very comprehensive. It Once it works very well. So you can also be kind of cycling it on and off, depending on your degree of sleep dysregulation. You don't have to be taking it forever. And I think that's a goal with most supplementation, right? Is you do it for the period of time and you correct that deficiency, and then you kind of transition into those lifestyle habits. So one does not occur without the other. You have to make those lifestyle changes too, and really view sleep as a sacred activity.
So the Ortho Sleep can really be used as needed. When would people take it? Would they take it before they go to bed at night? Is it recommended to take it throughout the day?
It's recommended 30 minutes before sleep because it can be quite sedating, so we don't want to take it too early.
Can people take it in the middle of the night if they wake up?
Yeah, because the melatonin itself is not a slow release. We do have a melatonin dual cap that is a slow release. So if they're finding that they're waking up in the middle of the night, they can certainly take another. But again, you would want to be very cognizant of how long you've been taking it, and working with someone such as a sleep therapist or a naturopathic doctor, or yourself, to really understand why they have that sleep dysfunction.
Absolutely. Absolutely. Well, thank you so much for joining me today and sharing your knowledge with our customers. I'm sure that people have gained some insight and some helpful tips and education around sleep.
Thank you. Yeah, thank you for having me. It's such a huge topic, and I'm obviously very passionate about it, so it's hard to keep it so concise. But I appreciate your time, and thank you to your listeners.
Thank you, everybody, for joining our education series. I invite you to check out more health videos on our YouTube page. Be sure to follow us on Instagram and Facebook, and subscribe to our newsletter at naturalfoodpantry.ca. Thanks, everybody. Stay healthy.